So let's talk a little bit about photodynamic therapy now. We showed photodynamic therapy on the videotape here of our TV show before we got started. What it is, because Don Blue helped us out with the videotape. He's a DJ on 101.3 FM. Photodynamic therapy is a great treatment cosmetically, but it's also a great treatment for preventing skin cancer, because what it does is what we do is we apply a topical medication called Levulin to the top of the skin. It's absorbed into the cells, and then we activate that medication with the photofacial treatment. And so the patient gets both the benefits of the photofacial plus what the medication does. That medication is absorbed only into rapidly growing cells like precancerous cells or sun-damaged cells, and it's not absorbed by normal cells. So as a result, when we activate it, the medication turns into protoporphyrins, which actually kill the bad cells. So we can selectively kill off bad cells and save good cells. So as I say, Don Blue was one of our patients for this, and he came in and we did a series of 5 treatments on him. He had a lot of pre-skin cancers along the side of his face and down here from sun damage when he was young, and still played and still plays a lot of golf too. And by treating him, we were able to get rid of all of that sun damage, whereas he'd been going for year after year after year, actually every 6 months for many years, having these little pre-skin cancers treated with liquid nitrogen, which is the classic way to treat it. And the liquid nitrogen gets rid of it on the surface, but it doesn't go down deep to kill it underneath. So when it's treated, it comes right back eventually. You have to treat it again, whereas the Levulin will clear it up on a much more permanent basis. It's also good for acne, and we treat a lot of patients with acne who don't want to take Accutane with it. Accutane is the most potent medication for acne, but it has a lot of side effects. It's taken by mouth. It causes potential changes in the body, and so as well as it can cause depression. So a lot of parents don't want their teenagers taking it, but the photodynamic therapy works somewhat similarly, but it's only in the skin in that it kills off bad cells, as does Accutane. So people can get this topically without having to put something into their body. It's not Accutane. It's a completely different medication than Accutane, but it has a lot of the similar end results. So here's a patient who had acne, and we treated her, and after several treatments, you can hopefully see that there's acne, and here it's gone. And here, treatment, and quite a bit better here. Here's another patient after 3 treatments, pretty severe acne. And you can see that it's gone a long way to clearing up. It's not gone yet after 3, but it's certainly much better. It typically takes anywhere from 4 to 8 treatments. And if one sticks with it, it pretty much always works. There is some downtime to it, though. People turn red and a little bit peely for a couple days to even a week after the treatment. But a lot of teenagers are very willing to put up with that to get the end results. Here's someone who had it for some pre-skin cancers and some brown spots. And the brown spots are sort of here. It's a little bright to see that probably. Let me try the next one. I think you can see it better here. All these brown spots were there prior to treatment and after treatment. So this is prior and after treatment on both sides. You can see most of it has cleared up.